All right, we're here with Dr. Mike. And Dr. Mike, you're in business class. You're enjoying a nice beverage of your choice.
Wow. Upgraded by the airline? Or?
Absolutely.
Okay.
You paid for a coach ticket, but they upgraded you because you are, well, you. Wow. And you're enjoying that. You've got a nice smile on your face, and you hear this PA.
Sir, excuse me, sir. I'm sorry I have to wake you. You a doctor?
That's right.
And the flight attendant comes on and says, "Is there a doctor on the airplane?" Your ears perk up. You take it from there. What do you do at that moment?
You'd better tell the captain we've got to land as soon as we can. This woman has to be gotten to a hospital.
A hospital? What is it?
It's a big building with patients, but that's not important right now.
Extreme anxiety and excitement at the same time. And you have to choose which crossroads you're going down.
Yes.
Because if you go down anxiety, you could panic so hard that you end up just staying quiet.
Yes.
But then there's also excitement for the fact that I can be useful.
Yep.
And I very much enjoy being useful, especially as a family medicine
All
doctor.
right. So that old Hippocratic thing comes out and you're like, I've got to save the day. And so you hit the call button and it lights up and they come over and they first look at you and they go, "Sir, are you a physician?" And you say, "Yes, of course." And then they stop and go, Are you Dr. Mike?" And you go, "Is there somebody that's like dying on the airplane?" "Well, yeah, he's having a seizure back there, but do you have a minute? Can we have a selfie together?" So you get through the selfie thing, right? And you go back and there's somebody that is, having some sort of issue. Usually it's like, my experience has been, it's a diabetic that their pump stopped working and they've spiked, or it's somebody maybe elderly that get up to altitude and they probably just need a little oxygen, but it looks kind of serious at first.
Or anaphylactic shock.
Okay.
Which happens.
Yeah. So that's where you come in. You look and you just immediately sum it up, and where do you go from there?
Speaking from experience,
Yes.
Step one is figuring out, is landing a possibility?
Yes.
Because that's what's going to change the course of treatment.
Yeah.
If we're in the middle of the Atlantic Ocean, I know landing is not possible, the options change drastically.
Right.
And then you ultimately want to figure out what symptoms is the patient having, what brief history can you find out, how long did these symptoms go on for before this terrible acute incident happened, what medications the person's taking, and most importantly, have they just had one of these issues come up? Because it happens that when someone has, let's say, a heart attack, God forbid, on a plane, if they had a heart attack a few weeks ago, odds are it's a repeat incident.
Okay.
It's almost a trick question that we ask our young students. Hey, what's the highest likelihood, like what part of someone's history will determine that someone has a high likelihood for a heart attack?
Yeah.
And the answer is if they just had a past heart attack. So getting all that information very quickly and then moving on to the vital signs, the physical exam, then deciding what to do.
This is awesome. See, if I'm having a problem in the back of the airplane and you show up and you've got that whole Rolodex of things already set up that you're going to do, I'm like, this is great. This guy's going to save the day. I feel good about that. Now, I've had this happen a bunch of times. I've been at the airlines for 34 years, and you get a call from the back and somebody's having a seizure or whatever. In time, I eventually try to go back and see what's going on, because getting the translation through the door, you kind of lose a lot, right? So I go back and I take a look, and we had this one episode and there was a physician there. But I asked him, they had just called for a doctor. So I said to him, I said, I'm the captain, right? I show up and I said, "Are you here to," he said, "Yeah, I'm taking care of this." I said, "Are you a physician?" Just to be clear.
I have a PhD in education.
Yeah, so he looked at me. He stared right through me and he's like, "Of course I'm a physician." I'm like, "Dude, I have to ask the question." I said, "Because they've had doctors, PhDs, respond in the past. That's why you have to say a physician instead of a doctor. I'm a doctor, right? I don't have those 10, 12 things that you do. I'm going to come back and look at somebody and go, how do you feel?" That's going to be the first question. And then I'm going to say, "Dude, you look really awful.
Is there anyone else that can help?
Yeah, perk up,
Well, there's a hierarchy here of who you would want on your airplane to deliver care.
Yes.
Family medicine is up there, but I think like EMTs, ER physicians, those are top. I think once you're reaching for a PhD, maybe even a dentist, then you're going to be in trouble just because of the lack of experience in situations like that.
Well, that's always my second question is, okay, what kind of doctor are you? And the guy says, "I'm a gynecologist." Like, okay, well, we're not delivering a baby, but that's okay. You got a lot more medical experience than virtually anybody else in this airplane. And you're right. The EMTs are really the no offense, but
EMTs,
they're used to that.
ICU nurses, those are the people that are putting in the hours day in and day out that have just that recent experience, because recent experience is more powerful than having residency training 20, 30 years ago.
So the question that I got a lot was, okay, so who makes the call? Or is it the physician that's on the airplane? Is it the captain?
Captain, how soon can you land?
I can't tell.
You can tell me. I'm a doctor.
No, I mean, I'm just not sure.
But can't you take a guess?
Well, not for another 2 hours.
You can't take a guess for another 2 hours?
There's a thing called physician on call where I make a satellite radio call to somebody who's sitting around waiting for a call
Wow.
from an airliner. So I talk to
I
this
want that
doctor.
job.
Yeah, there it is. It's a great job. And we talk back and forth. They ask all the questions you asked. I get it relayed through the door. I pass it on to them. And then collectively, the two of us kind of make a decision. Are we going to divert? Are we going to press on? Ultimately, at the end of it, I really lean on the physician on the airplane because they're the ones right there
Right.
getting a feel for it. And then that's why I get paid the big bucks is I got to make a decision. Are we going to press on or are we going to, land someplace short? And again, you always want to err on the side of
Patient
safety and health and all of that. And sometimes I've gone on to destination and a couple times we've diverted. And it
Yeah, I
just
think
depends.
it probably, in your case, would be important to you how confident
Yes.
the physician is about the given situation.
Yes.
Because if you ask the physician, you say, are you confident? Is everything safe with the person? Are they stable? And they go, yeah, I think so. That might give you enough pause to say, okay, we should probably be diverting
Right.
because it's not clear what's happening.
No, I've usually got 2 or 3 really reliable voices giving me direction, and then ultimately I get to make the decision. So, having said all that, if you're on a flight with Dr. Mike and Captain Steve next time, and ladies, please do not faint for obvious reasons on this because I will be very put out. I'll get to the bottom of it right away. I know exactly what you're up to. All right, well, this has been absolutely great. Thanks for participating in my silly questions. Well, now you know. I'm Captain Steve.
And I'm Dr. Mike.
Fly safe.